ACCUPLACER Health Professions Anatomy Questions. Question 1. A study plan assigns 27 review questions per day for 6 days, but 7 are skipped. How many questions are completed? Option A, 162. Option B, 26. Option C, 351. Option D, 155. The correct answer is option D, 155. The completed total is found by multiplying the daily amount by the number of days and subtracting the skipped questions, so the result is 155. The incorrect choices ignore the skipped questions, add unlike quantities, or multiply by the wrong total. Question 2. Multiply 5/4 by 5 to estimate the total number of practice sets completed in repeated sessions for review set 20. Option A, 25/4. Option B, 5/4. Option C, 5/2. Option D, 13/2. The correct answer is option A, 25/4. Multiplying a fraction by a whole number multiplies the numerator while keeping the denominator, which gives 25/4 after simplification. The distractors add the whole number, multiply both numerator and denominator, or change only part of the fraction incorrectly. Question 3. Divide 29.4 hours of review equally across 6 sessions. How many hours should each session contain? Option A, 35.4. Option B, 4.9. Option C, 176.4. Option D, 4.2. The correct answer is option B, 4.9. Equal sharing requires division of the total hours by the number of sessions, giving 4.9 hours. The distractors add, multiply, divide by the wrong number, or inflate the quotient. Question 4. A timed drill rises from 45 completed items to 54. What is the percent increase to the nearest tenth? Option A, 120%. Option B, minus 16.7%. Option C, 20%. Option D, 9%. The correct answer is option C, 20%. Percent increase uses the change divided by the original value, then multiplied by 100, giving 20%. The incorrect answers use the new value as the comparison base, report only the raw change, or treat total percent as percent increase. Question 5. If one skill station should serve 5 candidates and 180 candidates attend, how many stations are needed before rounding up for logistics? Option A, 185. Option B, 175. Option C, 0.03. Option D, 36. The correct answer is option D, 36. The number of equal stations before rounding is the total candidates divided by candidates per station, giving 36. The other options add or subtract instead of forming a rate, invert the division, or round when the question asks before rounding. Question 6. Convert 3.0 kilograms to grams for a quantitative reasoning item. Option A, 3,000. Option B, 300. Option C, 30. Option D, 0. The correct answer is option A, 3,000. Kilograms convert to grams by multiplying by 1,000, producing 3,000 grams. The other choices use an incorrect factor, divide, or add a kilogram rather than converting. Question 7. Determine the solution to 3x8 equals 16 during an algebra warm-up. Option A, 9. Option B, 8. Option C, 7. Option D, 24. The correct answer is option B, 8. Adding 8 to both sides gives 3x equals 24, and dividing by 3 gives x equals 8. The other choices miss the addition step, stop before division, or adjust the solution by 1. Question 8. A candidate has 120 questions to review, has finished 60, and splits the rest evenly over 9 days. How many per day? Option A, 13.33. Option B, 69. Option C, 6.67. Option D, 15.67. The correct answer is option C, 6.67. First subtract completed work from the total, then divide the remaining questions by the number of days, giving 6.67. The other choices divide the wrong amount or add days instead of distributing the workload. Question 9. Calculate the range for the completion times 11, 20, 14, and 16 minutes. Option A 15.2. Option B 15. Option C 20. Option D 9. The correct answer is option D, 9. The range is the maximum minus the minimum, so 20 to 11 equals 9. The other choices are the mean, median, maximum, or minimum rather than the spread. Question 10. A question bank has 23 items, and 6 are flagged as difficult. What is the probability of randomly choosing an unflagged item? Option A 17/23. Option B 6/23. Option C 23/6. Option D 17/6. The correct answer is option A, 17/23. Unflagged items are found by subtracting flagged items from the total, then dividing by the total, so the probability is 17/23. The other answers use the flagged probability, invert the relationship, or use the wrong denominator. Question 11. A table includes points 0, 10, and 4, 10. What is the slope of this horizontal relationship? Option A, 10. Option B, 0. Option C, 4. Option D, 2.5. The correct answer is option B, 0. A horizontal line has no change in y, so the slope is 0. The other values use coordinates as if they were slope or assume a downward trend that is not shown. Question 12. Find the area of a rectangular study table that is 7 feet long and 9 feet wide. Option A, 32. Option B, 16. Option C, 63. Option D, 126. The correct answer is option C, 63. Area of a rectangle is length times width, so 7 times 9 equals 63 square feet. The other choices calculate perimeter, add dimensions, double the area, or subtract dimensions. Question 13. Select the best central idea of this statement. Clinical students often improve faster when they connect math skills to realistic patient care situations. For review set 20. Option A. Testing should be avoided whenever possible. Option B. Only memorization matters in health programs. Option C. Long study sessions always produce the best results. Option D. Applied practice can make academic skills more useful for health programs. The correct answer is option D. Applied practice can make academic skills more useful for health programs. The central idea should summarize the whole statement without adding a new claim or narrowing the focus too much. The other choices either contradict the statement, exaggerate one detail, or introduce an idea that the sentence does not support. Question 14. Infer the most reasonable conclusion from this note. The advisor recommended a math refresher before the applicant retested. For review set 20. Option A. The applicant likely needs stronger math readiness before placement. Option B. The note proves the student has already mastered every topic. Option C. The note rejects the value of organized review. Option D. The note focuses only on memorizing answer letters. The correct answer is option A. The applicant likely needs stronger math readiness before placement. A reasonable inference must follow from the information given without stretching beyond it. The incorrect options are too absolute, contradict the note, or claim details that are not stated. Question 15. In an academic sentence about health program readiness, what does the word ambiguous most nearly mean for review set 20? Option A. Proven by exact data. Option B. Open to more than one meaning. Option C. Written with perfect grammar. Option D. Arranged in time order. The correct answer is option B. Open to more than one meaning. The word ambiguous is used in academic contexts to mean open to more than one meaning. The other choices describe unrelated actions, opposite meanings, or features of writing that do not match the term. Question 16. Why would a writer likely defines a technical term before using it in a paragraph for review set 20? Option A. To distract readers from the main claim. Option B, to remove the need for supporting evidence. Option C, to make the later explanation easier to understand. Option D, to make the paragraph less organized. The correct answer is option C, to make the later explanation easier to understand. A rhetorical choice should help the writer develop meaning, guide the reader, or support a claim. The incorrect options describe weak writing moves that would reduce clarity or relevance. Question 17. Combine these two ideas most accurately. Math placement often affects course sequencing, and health programs may require strong quantitative readiness. For review set 20. Option A. Only the first idea matters for test preparation. Option B. The two ideas contradict each other completely. Option C. Neither idea can be used in academic preparation. Option D. Quantitative readiness can influence a student's health program pathway. The correct answer is option D. Quantitative readiness can influence a student's health program pathway. A synthesis should preserve both ideas and show the relationship between them. The incorrect choices ignore one idea, invent a contradiction, or draw an unsupported extreme conclusion. Question 18. Choose the sentence with correct subject-verb agreement for review set 20. Option A. The list of practice topics is posted before orientation. Option B. The list of practice topics are posted before orientation. Option C. The list of practice topics were posted before orientation. Option D. The list of practice topics be posted before orientation. The correct answer is option A. The list of practice topics is posted before orientation. The verb must agree with the true subject, not with a nearby prepositional phrase or distracting noun. The incorrect choices use a verb form that does not match the subject or create an incomplete sentence. Question 19. Select the sentence with the clearest punctuation for review set 20. Option A. The practice test was difficult, however, the explanations made the errors easier to understand. Option B. The practice test was difficult, however, the explanations made the errors easier to understand. Option C. The practice test was difficult, however, the explanations made the errors easier to understand. Option D. The practice test was difficult, however, the explanations made the errors easier to understand. The correct answer is option B. The practice test was difficult, however, the explanations made the errors easier to understand. Correct punctuation shows how ideas are connected and prevents sentence confusion. The incorrect choices omit needed commas, misuse punctuation between clauses, or place punctuation where it interrupts the sentence. Question 20. Pick the sentence that uses standard English correctly for review set 20. Option A. A student should bring their identification to the testing center. Option B. A student should bring the identification to the testing center. Option C. A student should bring his or her identification to the testing center. Option D. A student should bring them identification to the testing center. The correct answer is option C. A student should bring his or her identification to the testing center. Standard usage requires correct pronoun case, verb form, and count word agreement. The incorrect choices use non-standard pronouns, mismatched verbs, or less/fewer incorrectly. Question 21. Choose the best transition for the blank. The evidence shows that spaced practice improves retention. Blank, the advisor recommends daily review rather than cramming. For review set 20, option A. Although. Option B. For example. Option C. On the other hand. Option D. Therefore. The correct answer is option D. Therefore. The transition must match the logical relationship between the ideas, such as contrast, sequence, or cause and effect. The other choices signal relationships that do not fit the sentence. Question 22. Choose the most concise revision of this sentence. There are many students who benefit from reviewing missed questions. For review set 20. Option A. Many students benefit from reviewing missed questions. Option B. There are reviewing missed questions from many students who benefit. Option C. Many students, who are many, benefit from missed questions reviewing. Option D. Reviewing missed questions are benefited by many students. The correct answer is option A. Many students benefit from reviewing missed questions. A concise revision removes unnecessary words while preserving the original meaning. The incorrect choices are awkward, wordy, grammatically flawed, or less clear than the original. Question 23. Using common medical word parts, what does bradycardia most likely mean for review set 20? Option A, rapid breathing. Option B, slow heart rate. Option C, high blood sugar. Option D, kidney inflammation. The correct answer is option B, slow heart rate. The word parts in bradycardia point to slow heart rate. The other choices use different roots, prefixes, or suffix meanings and do not match the term. Question 24. Choose the tissue type that lines many body surfaces and cavities for review set 20. Option A, nervous tissue. Option B, bone tissue. Option C, epithelial tissue. Option D, adipose tissue. The correct answer is option C, epithelial tissue. Epithelial tissue covers surfaces and lines cavities. Nervous tissue transmits impulses, bone tissue supports the skeleton, and adipose tissue stores fat. Question 25. A graph shows scores rising as daily review minutes increase. What relationship is suggested for review set 20? Option A, negative association. Option B, no relationship. Option C, circular reasoning. Option D, positive association. The correct answer is option D, positive association. When both variables rise together, the relationship is positive. A negative association would move in opposite directions, no relationship would show no pattern, and circular reasoning is not a data trend.